episode 4 of the Leading Edge Clinic podcast. I'm your host, Mark Bishofsky. I'm an employee at Leading Edge Clinic. I'm a health freedom activist and a practicing respiratory therapist who sometimes still works on the other side, if you know what I mean. Today, we're going to dive into and learn about spikopathy, more specifically, post-vaccine injury syndrome, COVID vaccine injuries, with provider, nurse practitioner, India Scott. We're also being joined by India's, I would say, main registered nurse, Karen Gates. India has extensive experience in addressing the adverse effects of these COVID-19 injections, and by now she has encountered a wide range of ways in which these shots can affect people. The providers at Leading Edge Clinic have streamlined their approach, identifying which treatments are effective and which are not. However, the treatment for these jab-related injuries is not one size fits all. What works for one person might not work for the next, and these treatment protocols continue to evolve as new therapies are discovered. It seems like every few weeks something new is discovered and tried, and typically it works. So again, it continues to evolve, and I cannot wait to get into this conversation tonight so that I can learn along with you, the audience, just how complex this type of treatment is. How are you guys doing tonight, India and Karen? Good. So I did see that we should be live. We are live on Rumble. It looks like it's glitching a little bit, which doesn't surprise me. It didn't go live on X because I was just notified when I clicked go live that we needed a premium account on X. Nonetheless, if there are any failures, this will be recorded. We are going to upload this on for a viewing on demand by tomorrow morning at 10 a.m. if there are any issues. But we're gonna move forward here. One thing I want to say before we go any further is I just want to clarify that what's being shared tonight is not by any means medical advice. The treatments we are going to discuss are intricate, and it's crucial to collaborate with a knowledgeable provider who can ensure that dosages are correct and that the treatments are tailored for your unique needs. Each individual's experience and the ways these injections might affect people vary greatly. So your safety, your well-being, and a positive outcome are our top priorities, which is why personalized treatment plans are so very important. And now we are going to get into it, but let's start with some basics here, India. What is spikopathy?
So spikopathy is a term that means a person has spike protein in their system and it's causing disease. So the disease is wide and varied because the spike protein can get into any cell in any organ in the body. And so what we see clinically usually is indicative of where the spike protein is has accumulated the most in the patient.
And I would say, based on what I'm hearing as a scheduler for Leading Edge, when folks call in to get some help, it seems like the spike protein or the nanoparticles, all of this whole mRNA, and even the J&J jab can affect every single organ in the body or all of them all at once and actually lead to spontaneous sudden death. I mean, so it's tragic. What are you seeing as the most common side effects of these jabs?
Well, the most common symptoms that patients present with are fatigue, post-exertional malaise, meaning they can go out and walk maybe a block, but when they get back, they have to take a nap because they're so exhausted. Neuropathy, pins and needle feeling type feelings in their hands or feet, shortness of breath, chest pain, tachycardia, mast cell activation syndrome, which is a reaction caused from you having something in your body that's not supposed to be there and your immune system is attacking it like it's an allergen, like you have an allergic reaction. And that can cause a lot of anxiety and really feelings like you're about to have a panic attack.
Yeah, absolutely. I'm going to kind of wing it here. We didn't have this question for you, but I'm sure you can answer it. So we also, Leading Edge Clinic also helps those suffering with COVID long haul. Are those the COVID vaccine injuries and long haul, would you say they're pretty similar? Is one more severe than the other? Are the symptoms pretty much the same? I mean, severity is obviously going to be, different, but would you say they're very similar?
I would say so. It seems like the patients that have long haul, not all of them, but most of them seem to get better and maintain their gain of getting better. Whereas the patients who've been vaccinated can have reoccurrences of their symptoms or something new pop up after they've gotten rid of all of their symptoms and they're better. I just had a patient. We have a spike prevention program where someone can come to our practice that has had the vaccine or COVID, and they just want to know how many antibodies their body has made against the spike protein and help their body get rid of the spike protein. And I just had a patient who had a level greater than 25,000 who presented with no symptoms and had a shedding event. He took care of his son, who had a brain tumor, and for a month at his house, and he ended up having symptoms now. So the patients just have to be aware that just because they have high spike antibodies and no symptoms doesn't mean that this might not be a problem for them later on. I mean, it's an indicator that you have spike protein in your body, and it's important that you work on getting it out.
Absolutely. I mean, I think we're all at an increased risk. We've probably almost all had COVID, the infection, and or a vaccine, and shedding. So there's 3 different ways that you can get this spike into your body, and you need to try to get rid of it if all possible. Let's include you, Karen. Because we all have a different perspective. I'm answering the phone before people become patients, and I'm guiding them. India, you're treating them once they've become patients. It's really, really comprehensive with you. But what do you think, Karen? Do you agree with India that the vaccine injuries are more severe than the long haul?
100%. Yeah, we see it all the time. Yeah.
Yeah. And I think that's kind of, those of us that are awake, we realize that. Obviously, we're getting gaslit by the mainstream. But I'm going to go ahead and share. I came across a new study that just came out, I think, a couple weeks ago. So I'm going to try to share my screen here with this PowerPoint. Let me go back to the first slide. So this is a study. This study was done with 1,745 healthcare workers, and it was looking at how the boosters, COVID mRNA boosters, affected people considering influenza-like illness, not necessarily the prevention of COVID, but just how sick these people got in general for all cause. And I thought this was very profound. I'm just going to go to it says here, the conclusions based on our data, we conclude the SARS booster vax does not contribute to the protection of healthcare workforce in a post-pandemic setting. Yet they're still pushing these things. And then basically what the study found is that with 3 boosters, you had a 56% increased incident of influenza-like illness compared to the unvaccinated. And with 4 boosters, a 70% increase in developing influenza-like illness versus the unvaccinated population, and a 49% rise in lost work days. So why? I know you know that. I mean, why are they still pushing this thing? It's
a crime against humanity. They've got to stop the shots. It really, really makes me mad. And I'm getting more and more upset about it as time goes on, because, any other drug that has caused so much death would have been pulled from the market. Why is this not off the market?
100%. And the Surgeon General of Florida speaks to it all the time, that it should be pulled off the market. I don't understand why it's not.
Yeah.
I don't either. It's
sickening, especially being in our position and seeing what we see. And it's just very, very sad, and the reason is because the boosters are causing shedding. The more boosters you get, the more shedding you're going to have. And so, people who aren't getting vaccinated, that are taking care of their vaccinated sick family members, are getting sick because of getting more spike protein in their system. And we're seeing this with lab results. This is not something that we're, hypothesizing because this patient has presented with increased symptoms. I've actually seen their level of spike antibodies go up. And someone might say, oh, well, antibodies can go up for any reason, exposure to COVID. Well, 18,000 is not an exposure to COVID in someone who's not been vaccinated. And I just recently had this happen to a patient.
It is so sad. I mean, I think
Yeah.
all of humanity has been poisoned from a lab-generated gain-of-function Frankenvirus, and then these injections. I refuse to call them vaccines. I think sometimes I slip and do call them that. And I'll just say, too, before we get into the case study, of something I noticed. Like I said at the beginning, I'm a respiratory therapist. I still do work in the system, unfortunately, for better or worse. I do think there is a place for those that are awake to advocate. But what I'm seeing is that since these vaccines, the injections were rolled out, it has been busy ever since then. Typically pre-2020, it was always slow in the summer, always.
Yep.
And now it is not. There is no slowdown. It is always busy. And at one of these facilities I work at, you're able to see people's status. And pretty much, bar none, everyone who comes in with some kind of crazy illness has been jabbed not too long ago. And it's really unfortunate because it's usually the elderly folks, not that 60s elderly, but 65, 75, 80. Those are the folks they trust the doctors, unfortunately. And these doctors are still pushing this. And this pandemic is over. It has been over. People are dying and they're losing their quality of life because of this. And it is terrible. But thank goodness for Leading Edge Clinic, who's helping so many people. I mean, it has to be many, many more than thousands at this point. And what an honor to be part of this mission.
It's very rewarding to help someone get back to a functioning state to where they can work again, or, they can at least enjoy their life to some degree. It's been very rewarding and at the same time shocking. Sometimes I have to go, wait a minute, am I really treating patients for a vaccine injury and a vaccine that's still on the market? Like, I can't, sometimes it's still hard to believe that this is happening.
It's like living in two separate realms.
Yeah, it is, because no one's talking about it.
No.
And that's okay. We're going to talk about it, but it's just really a big deal.
It is. And like you said earlier, like if you think about, let's just say a lawnmower has some kind of faulty component where the blade flies off. And if one person dies, that thing is going to be pulled off the market and they're going to have to fix that. And there's going to be liability. These pharmaceutical companies have indemnity to kill people and they have zero liability. It is such a shame. The PrEP Act needs to be reversed. But let's get into it, India. Let's kind of give us a description of, so we're going to present a case study. We're going to, HIPAA, so we're not going to be talking about names or anything like that, but we're going to present a patient case. And India is going to, I guess, just describe in general when the patient came, what they were their complaints when they first came to us.
So this patient was is now 33 years old, and so when he came to me, he was 31. He was vaccinated in 2021, and that's when his symptoms began. I will say, before that, he got COVID December 2020 and had some brain fog and anxiety after that, but that lifted. And then because of his job, he had a great job. He was a young professional starting his career, working, about to travel nationally. So he had to get the vaccines. And in 2021, November of 2021, after the second shot, he began having brain fog, anxiety, shortness of breath. And so he went to his primary care doctor. And because he had a history of obsessive compulsive disorder a long time ago, she decided to send him to a psychiatrist. And so he saw a psychiatrist for 3 months, and they prescribed medications that didn't help him. So he came back to her, and she referred him to a neurologist. They did an MRI, showed a little lesion on his parietal lobe that was there from birth, and the neurologist decided it wasn't causing any problems. EMG study, because he was having some neuropathy, which is pins and needles and pain in your hands and feet. That was negative. He also had a EEG, because the EEG test is done when you've had a seizure. So he had been given a medication called fluvoxamine and had seizure-like side effects. So the EEG was negative. So when he presented with me, he had extreme fatigue. He had to prioritize his tasks throughout the day so that he'd have enough energy to do what he needed to do just to survive for the day. Now, this is after the fact that he had to stop his job because he went through vocational rehab and, to try and get his brain working enough so that he could work, and it didn't work out. So he had to quit. And he was having trouble really just functioning on a day-to-day basis. But his brain fog, he had brain fog and executive functioning difficulties. He had organizational and critical thinking skills were very, very low. And I'll never forget my first visit with him. He was sitting at a picnic table outside, and he had a really hard time conversing with me. I would ask him a question. It would take him a long time to answer. And he was very nervous and kind of moving around a lot, not making eye-to-eye contact. And so I was really concerned, about his status. He had neuropathy that's really bad. He could only stand on his feet for so long without the pain being severe. He had joint pain. He had shortness of breath. He had chest pains. And the chest pains weren't your typical, as a clinician, you always ask, okay, does this chest pain occur when you're, exerting yourself? And does it go away when you sit down? Well, it didn't fit that clinical picture. So I knew it wasn't a blocked artery. But he did have shortness of breath that was not associated with the chest pain. He also described this he called it a neurological discomfort, where he would wake up and his arms were paralyzed. He couldn't move in the middle of the night. And it was very, very scary. He said it felt like his arms were asleep, but he couldn't move them. He also had this derealization sensation, and a lot of patients describe this to me, where they just they feel like they're in a shell, and like they're in the world, but they can't really communicate. It's like they're looking at the world from inside a shell, and that was causing social problems because it was hard for him to respond to people when they would speak to him because of that sensation. So the tasks, he also described it like this: the task that he had done in the morning, in the afternoon, they seemed like they were like a lot further away, a lot of a longer time before. So his first treatment, well, let me just back up and just say, in late 2022, he had learned about ivermectin, and he went to one of his providers and they wouldn't prescribe it. They said it would do more harm than good, but he did get some and it did help him. So when I first saw him in August 2023, so this was when he got the ivermectin was fall of 2022, and I saw him August 2023 for the first time.
Okay, so India, he was 31 then in 2023 when he came to the practice. So he was actually 29
when all of this started. Yeah.
When all this started. And do you happen to know how long after this, because it was the second injection, right? Which I hear a lot. Do you know how long after that injection that he kind of started to realize he'd been damaged? If you don't know that, I mean, you're not going to know all of his history, but I'm just curious.
Yeah, it was soon after. It was within days, from what I understand. Yeah.
Tragic.
Yep. And it was fatigue, shortness of breath, anxiety, and cognitive issues right away. Yeah. So since he got a good response with ivermectin, I went ahead and gave him a higher dose of it, hoping it would work even better. I started him with something called augmented NAC to help get rid of the spike protein, and just to kind of give everyone an idea of what's going on with the spikeopathy in the brain. There are about 7 different mechanisms of action on how it can cause dementia-like symptoms. And so I'm just going to go through those so you understand my treatment plans.
Please do.
Yeah. So one is neuroinflammation. So the spike protein crosses the blood-brain barrier and can cause inflammation. We have a system in our brain called the glymphatic system. It's separate from our lymphatic system, and it helps to drain toxins out of our brain. And so keep that in mind, because there are reasons why our glymphatic system isn't draining with spikeopathy. Okay. Neuroinflammation is something that can cause a disruption in the neurotransmitters in the brain. And the antibodies from the spike protein can do the same thing. So you don't only have spike protein in the body, but you have this large amount of antibodies that are attacking the spike protein in the cells. So, autoimmune diseases are an attack of antibodies. So it's almost like everyone has an autoimmune disease, with high spike antibodies. There's really no other way to put it. And that causes neuroinflammation as well. Microclotting is huge. So microclotting causes the tiny, tiny blood vessels in the brain to have these little tiny clots, which prevents the cells from getting oxygen and nutrients that they need. So if you can imagine the cellular dysregulation that will cause, that's one of the causes of dementia in older people, is poor perfusion and ischemic issues. So
it's like a bunch of little mini strokes.
Yeah. And so there's actually an article about this too, a research article about how the microclotting mimics TBI, traumatic brain injury, in the way that it causes the inflammatory response. So you've also got that going on. Neurotransmitter disruption, like I said, we check neurotransmitters in urine, but it's a guide, because what the neurotransmitters in our body are getting rid of, which is what we check in urine, can be a reflection of what's going on in the brain, but the brain it can be very different. So usually with that guide, though, I see good results with supplementing the patient with amino acids to help their body make those neurotransmitters. The other one is misfolding of proteins. So this is called prions disease, and this can cause, dementia, and it can be very, very progressive.
Like mad cow disease, correct? Isn't that a prion disease?
Yeah.
Yeah.
So dysregulated thyroid hormones. So this one is a biggie. So T3 is our thyroid hormone that is active and helps our brain function. It helps our metabolism. It helps us to be happy as it stimulates serotonin receptors. And it's often downregulated. Why? Probably because our body is in this emergent state, and our body is trying to downregulate our metabolism. So what happens is we see a high reverse T3 that blocks all of the free T3 that's available for the patient to use. And so I had a patient that was in his 90s, and he had a really, really high reverse T3, low free T3. Correcting that actually helped him the most with his dementia.
Wow, that's fascinating. Just such an indirect treatment to help, who would have thought?
Yeah. So I always check thyroid hormones. In this particular patient, his thyroid was not dysregulated. And then you have the glutamate imbalance that I think probably most people do get. And glutamate's an excitatory neurotransmitter that if it's too high, it can cause you to have a lot of neuroinflammation and racing thoughts, poor memory. If it's too low, you can have a lot of fatigue and cognitive decline as well. So you have to have that happy balance.
Okay, so that's something that's measured in the neurotransmitter test that you order?
It is. It's interesting because, So in moving along, what's interesting about this person is that the first 4 visits that I had with him, he didn't get any response with treatment. He didn't feel any better. And so I encouraged him to continue on because we were always learning about new therapies, and he did. So on day 1, I gave him the augmented NAC, low dose naltrexone, and gave him a higher dose of ivermectin. Did a microclot test, which I like to do the microclot test that Dr. Jordan Vaughn offers to show us from 0 to 4, what is your microclot level? 4 being the most, 0 being no amounts of microclotting. And this individual had a microclot level of 3.5, I believe. Let's see here.
Yeah, that's pretty maxed out then at 3.5.
Yeah. Yeah, it was actually 3 out of 4. So I did start him on anticoagulation therapy, and I always go low and slow with that, which is Eliquis. It was at that time Eliquis, Plavix, and aspirin. He had no problems at all with bleeding, bruising, anything like that. And at the follow-up for that, he had no improvement, which was shocking because usually with anticoagulation therapy, we can usually see a drastic improvement. I mean, people can just literally get better within a week. So a little disappointing that he didn't respond like that, but we continued to push through. And I did the neurotransmitter test on him and used amino acids to balance his neurotransmitters. I also continued the anticoagulation therapy because in my experience, if someone has a 3 out of 4 microclot level and they have inflammation on the endothelial lining of their blood vessel walls, all of that needs to heal so that they can prevent clotting in the future, but also break down the clots that they have so that their brain can function, or their bodies in general can function in the way that they need. So he continued that therapy for 3 months, and I added some other supplements to enhance his ability to break down clots, like Nepronol and lumbrokinase.
Okay. And I'd like to just go back to the neurotransmitter test once. So how many of the patients that you see end up getting a neurotransmitter test? And then I want to ask Karen about that a little bit. Is it pretty common that you're ordering the neurotransmitter test?
It's pretty common in patients who have cognitive issues or depression, anxiety, and that kind of thing. Yeah.
And then Karen, I think this is where the nursing staff really is key in this proactive type of care that we provide at Leading Edge. Where do they get the neurotransmitter test?
We use Rupa Health, and India will order the neurotransmitter test through Rupa Health. It's a different platform for labs. We actually order a lot of labs through Rupa Health that are not serum type labs. They're either urine or stool or saliva. And Rupa will email the patient, and then they'll send them a kit, and that's how it's done.
Is it a urine test?
The neurotransmitter is a urine test, yes.
Okay, thanks for that, Karen. Okay, go ahead, India. I just think that's good for the audience to know.
I think India's frozen.
Yeah, she might.
Sorry, guys. My computer went out.
Well, that's all right. It's a good thing we went to Karen for that because we only lost you for a few seconds then. We're good.
Yeah, sorry, guys. So what did I miss?
We just talked about the neurotransmitter test, where patients would get that drawn. I think because, I don't know, over time, a couple thousand people will watch the show. There may be people that, want to know that information. How does this clinic work? Since we're virtual, we order labs. They don't come to us. Basically, wherever you are in your local area, there's, a lot of times, like Karen said, a test for the neurotransmitter can be sent. The kit can be sent to your house. Then, you send that kit back. We get the results. You get the results, and then we treat based on that. Sometimes you're sent to a LabCorp, which they're all over the country. So we have 20 some odd nurses here at Leading Edge Clinic. It's a big staff, and the nurses are, a key component in successful outcomes in helping people get this stuff done, answering questions. So we just kind of discussed that a little bit, India.
Okay, great. Yeah. So, so after he did the neurotransmitter test and started him on a regimen, let's see here. Sorry, I lost my spot.
No problem. We're just regular people having a conversation. I think you kind of left off on the neurotransmitters and you started giving him some amino acids. And did he respond to that?
He actually did, but he started responding before that. So what I did was, I added Flav. If anyone is familiar with that, Flav is a supplement the compound is called pycnogenol, and pycnogenol separates platelets and prevents them from sticking to the side of blood vessel walls. And so I actually maximized his anticoagulation therapy, the Plavix, and added the Flav. Decreased his ivermectin, increased the nattokinase, added Flav, increased lumbrokinase, and I also offered him the ARC device. So the ARC device has been helpful for him as well. I mean, this person has pretty much done all of our treatments, and interestingly enough, synergistically, they've all helped him. So, it's quite fascinating to see. But after his follow-up of just increasing the natto, the lumbrokinase, and his Plavix, he responded saying he had better sleep, less derealization, and some improvement with his mental clarity. So even with this minor improvement, he was very, very encouraged, because he hadn't seen any improvement in years.
Sure.
Yeah. And so he had asked me about hyperbaric oxygen therapy, and I told him it was okay to do that. He never did because it's very expensive. So on the following visit, I actually added nicotine. Okay, and Protandim. And Protandim is a supplement that has bacopa, curcumin, something that helps to decrease inflammation. And that seemed to really help him too. And then I also added our favorite baobab powder. So baobab powder has EGCG in it, a lot of vitamin C to help boost the immune system, and also has pectin to help get rid of spike protein. Addressed his adrenals because he was really, really tired, gave him adrenal vitamins. And then at the number 6 follow-up, which this is February 2024, he began seeing improvement in memory, fatigue, and cognition. This was the 3-month part of him taking anticoagulants, so I started weaning him off of that. His neuropathy was improving by 15 to 20% with laser therapy. He was having less crashes. He was exercising 45 minutes a day and meditating. And he uses these apps to monitor his cognition and doing these tests. And he noticed that those were improving.
Awesome.
Yeah. And so he did a lot of things on his own. Like he got a therapist. He saw a therapist regularly. And she was aware of what was going on with the vaccines. So she was helping him with the derealization type symptoms. But he also responded really well to Safe and Sound program. So
I say that.
Yeah, and so he did end up getting the ARC device. And the ARC device, I'll get back to Safe and Sound, but the ARC device is a really unique tool. It was originally made from horses or for horses to heal their limbs because, you know, their limbs are really hard to heal. So it's this little device you put on their leg and it heals their leg using microcurrents to help with increasing energy out of the mitochondria and helping the cells to be able to accept amino acids, other nutrients, and also get rid of toxins. So it helps your cells to be more permeable. And so he used that. And then he started Safe and Sound. And he really, when I talked to him the last time, he gave a lot of credit to his rehabilitation to the Safe and Sound program. And the Safe and Sound program uses sound to help calm down your nervous system and help calm down the vagal nerve so that you're out of getting you out of fight or flight, syndrome. So that really, really helped him with the derealization. I think that kind of completed that problem for him. You know, he really doesn't get that much anymore. He worked with Allie. He said Allie alone was just great to work with because she's very encouraging and really kind of like a therapist to him as well, because she's been through the whole vaccine injury problem herself, and she knew how he felt, and that was very, very helpful and reassuring to him, knowing that she had benefited from that program too.
Yeah. So for the viewers out there, so Allie works at Leading Edge Clinic. She does offer the Safe and Sound program. I don't know how many weeks it is. It's many weeks. I think you do a session a week. Maybe we'll put it in the notes.
14 weeks.
Yeah. And Allie was vaccine injured, and she's just an amazing human being too. You meet her, you talk to her, and you just know she's just so kind and compassionate. She wants to help. And again, she's been there. So I think unfortunately she's been there, but I think that helps her to connect with the patients. But yeah, we'll put that in the show notes, a link to our page about Safe and Sound.
Yeah. We're very lucky to have Allie.
Yeah.
For sure. But just to kind of fast forward, so this patient was doing really well, getting small improvements over time. And fast forward to December of 2024, he was getting something out of the trunk of his car, and the lid to the trunk hit his head, and he ended up with a brain injury, a concussion.
Wow.
Yeah. And so he had a really, really big setback. And I mean, I saw him on a visit. I said, look, I've got to see you. And so I saw him, and he's having a horrible headache and, having a hard time concentrating. And I said, you got to go to the ER. We got to make sure you don't have a brain bleed, So he goes, got assessed, and everything was okay. And when I saw him back, I said, look, go ahead and start oral DMSO. I said, it's used for brain injuries. It helps to heal ischemic tissue. And that helped move him along. And in 2 months, he was back to baseline of improvement. So it didn't set him back. He was able to get back to the place that he was, before.
Yeah, it's incredible. I think I should also mention too, so that wasn't part of a vaccine injury. So India does do also complicated medical cases. So people with a variety of chronic illnesses, things like that. So I think it just goes to show what the mission of this clinic and how we just want to help you be well. And India was stepped up and helped him with something that wasn't even related to the vaccine injury. And that DMSO is being used quite a bit now. Which, I mean, how many would you say of your vaccine injured patients are you trying it on?
Oh, just about all of them. I encourage them all to drink it because it's so medicinal. It actually helps. Prior to COVID, it was used for amyloidosis, which is the deposit of amyloid protein in tissues and organs, and spike proteins and amyloid protein. So it can help get the spike protein out of the cells and organs. It helps to separate platelets. It helps to increase platelets. So you have to be careful if someone already has high platelets. You don't want to give them that. But it helps to increase white blood cells. So talk about people who have a immunosuppression from getting many boosters. I mean, that's why they're getting so sick from the flu and other illnesses, is because they're immunosuppressed now. But DMSO can improve that with increasing white blood cell and monocytes. Yeah.
Incredible.
But it's also a really, really good anti-inflammatory for the central nervous system. So it really can calms the mind down and relaxes things. But it's an incredible substance.
Yeah, it's been used for years. I know when this came to light with Leading Edge Clinic, I kind of looked it up, and I mean, it's been used for stroke. I mean, the writing is on the wall. There are dozens of studies showing it. It should be like the standard of care for really stroke. I mean, everyone should be getting it. I take it. I mean, I think it helped with my chronic psoriasis, along with another therapy that I'm not going to talk about here. But DMSO, the only thing about it, it does not taste very good.
It's terrible.
And it has a bad smell.
Well, I've taken it myself, and my family made me stop because they said that the whole house smelled like DMSO. I thought it would smell like, garlic or something else, but they said, Mom, I can, and I was sneaky about it because I had stopped it, and then I took some, and they were like, did you take DMSO again?
It's funny, India, because today my wife came home and she walked in the front door. She's like, the whole dang house smells like DMSO, and so does the car, and I don't smell it, so you must be desensitized if you're the one taking it. So that is exactly really ironic that you bring that up right now.
Yeah, that's too funny. But yeah, so it's really, really very healing. And then he was taking he does chlorine dioxide baths. Those are very, very helpful. And then, I think that when did I start this? In May. Neuropathy was manageable. Cognition was, he was getting better. But that's when I offered for him to take and to start low dose sublingual ketamine. And since he's been taking that, his neuropathy is much better. The last time I spoke with him, which was a couple of weeks ago, he told me he was overall 90% better from
That's
what he was in the very
incredible.
beginning. Yeah.
Is he back to work?
He's getting there. He's starting to look for jobs and getting there. So
He's doing much better because it's harder and harder to get a hold of him when you call him.
Yeah.
For the follow-up. About doing something, living his life.
That's a good sign that he's doing better.
Exactly. Well, it was so interesting because back in December of 2023, I'll never forget this. It was December 2024. He and I were talking, and all of a sudden he started joking with me. And I hadn't seen this side of his personality yet, and so it was just so nice to see, wait a minute, he's got a really funny personality, and we were kind of joking back and forth. But, it was neat to see, himself, come back and to get to know him like that.
Yeah,
so, and that was
so rewarding.
That was with after he had done the Safe and Sound and with Allie, and I think that's really been helpful.
So is he no longer on the anticoagulation therapy? He's done with that?
Oh, he was done with that. I took him off of that. He stopped that 3 months after. So I usually do a 3-month span of that and then stop it. So he had stopped that, but he did start some sulodexide because, sulodexide is it's an anticoagulation drug, but it has other mechanisms of action. Like it actually helps to break down clots. It helps to heal the endothelial lining of the blood vessel walls. And it's helped people with cognitive issues in fatigue, chronic headaches. So he did take a round of that. But interestingly enough, he said that he really couldn't tell a difference when he took that.
Okay. But obviously he's still doing quite a few therapies. I mean, is he still on ivermectin?
Oh, yeah. Yes. Let me see here.
And I imagine he'll be on something for a long time. Because if for the viewers out there, if you watched episode 2 of this podcast, you saw we interviewed 3 vaccine injured, and they're still all on treatments. And in fact, Nick and Allie and Leslie, who work at the clinic, are all still taking a variety of treatments. But they're like Leslie reports, she's 100% improved from her vaccine injury. So, but
yeah, so it looks like at our last visit, so yes, he's taking a lot of supplements. And, part of the reason is because when someone's doing so good, you want to be careful about what you start taking off because you don't want them to slide back. So at his last appointment, we did discontinue some things and just kind of start peeling some things off. And I always tell patients, keep a journal and you stop one thing at a time and give it a week. If you have any returning symptoms, you want to restart that supplement. But so far, so good. He's doing really well. And I've had other patients come off of supplements and not have problems as well. So.
How often do you see him? Is he provider subscription or?
He was provider subscription for 2 years, and he just
now went to
nursing sub. So what that means is he won't see me every month. He doesn't need to see me every month.
And that's a good sign because he's feeling good enough that he doesn't need to see her, and he can just rely on the nurses calling him.
Yeah.
So with Leading Edge Clinic, you can get once you're done with care and you're feeling great, you can continue with a nursing subscription it's very inexpensive, and you basically can continue getting prescriptions. You can continue getting your questions answered. It's a great option so that you don't slide back.
Yeah, I mean, if I sat here and went through in detail his plans of care, it would bore it would be
Yeah.
bore us.
No, I like this. I like the way this
But
presentation has
but
gone.
but that I say that because I want people to know it's not easy, and it takes a lot of detail and being very, very thorough in covering all the bases of, okay, let's get spike protein out of your body, out of your brain. Let's decrease inflammation so that your body can break down its own clots. And let's decrease inflammation so we can decrease the inflammation in your brain. Let's work on the MCAS, mast cell activation syndrome, because otherwise, as patients are getting better, as they're getting rid of spike protein, their immune system's going to take a look at it and say, what are you? I'm going to attack you like you're having an allergic reaction. And that can cause anxiety, rapid heart rate, chest pain. It literally sends people to the emergency room. And so to get that under control is really, really important. And then let's work on the microclotting, because the microclotting causes a lot of the pathology involved here.
Yeah.
Mm-hmm.
Yeah. Amazing. And I want to bring up this. I'm going to share my screen here with these couple of things. So, like you watch the 6 o'clock news, you're never going to hear that people have been injured, cognitively or early dementia, things like that. But there are tons of studies out there showing that cognitive decline, cognitive deficits, memory impairments, early dementia are a side effect of these jabs. Obviously, there are millions of people who took these injections who are okay. They're the lucky ones. But there are millions of people who are the unlucky ones and who are suffering. For instance, Joel Walskog with
React 19.
React 19, the orthopedic surgeon who got the jab, an mRNA jab, and all of a sudden couldn't feel his legs, didn't think much of it, was actually standing over a patient doing a surgery and collapsed. I mean, and so he's now very vocal about it, but the ways in which the mRNA, the lipid nanoparticles, and everything in those jabs can harm you are infinite, and we're all at risk. And so for the viewers out there, if you're doing great and you don't have any side effects, I mean, again, like India said, Leading Edge does offer the spike prevention. So it's a treatment program protocol to get any spike proteins out of your body, even if you just have had COVID. I mean, like I said, we're all at risk, and
we're just to protect your body. Decreasing the inflammation that the spike protein has caused is likely going to lead to some type of disease later on. If you don't do something about it. I mean, it's so important for people to get on a program to reduce the spike protein out of their system and work on the microclots. I mean, I wasn't vaccinated. I don't have microclots, but I take a Nepronol every day to help prevent cardiovascular disease, because it helps to actually get the plaque off of arterial walls. I mean, some people are just really against taking a lot of supplements, but in this day and age of everything that we've all been exposed to our whole lives, we all have inflammation. We all have risk for cancer, for cardiovascular disease, for dementia. I mean, we all have to be really, really careful for cancer. I mean, it's
yeah, you never know. I was 47 when I had a heart attack after a DTaP vaccination caused an autoimmune disease in me. Yeah, and had a heart attack at 47. So that really woke me up, kind of led me down this path of being active against the mandates and all of that. And I'm extremely proactive. You never know if tomorrow's going to come for you. What is your life worth? I mean, my life is worth everything. I would give everything to have another day with my children. And we're all at increased risk of dropping dead. In fact, my wife's nephew from a previous marriage died at age 22, and he was a physical specimen athlete didn't wake up one day, and
Oh,
he was mandated to take the jab to play collegiate sports.
oh
And
no.
we know what did it. He had no past medical history, and we know what did that. And the studies show that a lot of people are producing spike proteins indefinitely. If you're an unlucky one, these vaccine might cause you to create spike proteins until the day you die.
So did they do an autopsy on him?
Yeah, and they just said it was enlarged heart. But you can stain for the spike, apparently, but obviously they don't want to do that. I mean, they could.
Yeah. Well, we know that it can cause an enlarged heart. I mean, we know that the spike protein, and what else would have done that in a 22-year-old?
Right. Somebody who's been extremely athletic, college level. Go ahead, Karen.
I was just saying a healthy 22-year-old.
Yeah, like literally a physical specimen.
From the beginning of COVID, when they said you can't go outside, you can't get direct sunlight, you can't exercise, that does make sense. All the things that are healthy for your body, you could not do.
You could go get a beer or a bag of marijuana.
Go to a porn shop. You can go get some alcohol.
Go to the strip club.
That's right.
Don't go to church, though.
But you can't go to the gym.
I mean, how profoundly, unbelievably insane is that? When you think about it now, you could go to the strip club, but not to church.
Exactly.
I actually understand why they kept the liquor stores open, because if they'd closed all the liquor stores, the hospitals would have been full of people going through withdrawals. So they had to keep the liquor stores open. I mean, there's a lot of alcoholics. I mean, we see it in the hospital all the time. People, withdrawing, their ammonia levels go up. They need a hospital for days, and that we would have been bombarded. So, but a strip club that did not need to be open. So it's just, what are they doing? What's really happening in this world?
Yeah.
Well, that's kind of what clued me in.
Yeah. Wow. Yeah. Well, yeah, a lot of things clued me in, but you know what? It was bad enough that COVID came around, right? And then to have the vaccines on top of that, just like, whoa,
Yeah. The better part of me thinks they brought the virus so that they could bring the vaccine. I do think that this was all planned, and we cannot prove that, but it really does.
We could ask Fauci, couldn't we?
Yeah, we could. We could ask Mr. Bill Gates, the de facto health expert for the world.
Oh, good gosh.
He and his high school degree, past criminal. So yeah, what a crazy world we live in. But I'm just grateful we have people like you two, Karen, in India, and a clinic, led by amazing providers with just an incredible mission to help people. Now, again, expanded to not just vaccine injury, not just acute COVID illness, now basically everything that you need help with. I would say almost every chronic health condition we can help with. Obviously, if you get hit by a car or if you're having crushing chest pain, you're going to need to go to the hospital. But for about everything else, I think we can offer some help.
Yeah. So, but thank you too, Mark, for what you do, spreading the truth.
Yes.
With your truth expedition.
Yes.
I'm definitely on an expedition.
Leading.
I love the name. It's awesome.
It was natural. I like truth, and it's definitely an expedition because it's so hard to find the truth. Because we're gaslit at every turn. We're lied to. In fact, audience, if you Google, does the COVID vaccine cause early onset dementia? AI is going to tell you, no, it doesn't. Absolutely not. But what a bunch of BS. We know it. Yeah. Anyone with half a brain cell knows that is not true. It does.
Yeah. Well, especially in young people. I mean, this isn't the first patient or the only patient that is this young that I've seen with this problem. This is, this is just one of them. The very first patient I had was, I was seeing them virtually. I was still in traditional medicine, and I was on a telehealth with them. He was in his car and he couldn't speak to me. So I thought he was septic because he had COVID. I thought he was septic. I said, look, you got to go to the emergency room. I think you're septic. So he goes to the emergency room, gets all worked up. I get the results back. No sepsis, no nothing. He had cognitive issues from COVID. Couldn't even converse with me.
Wild. Is he better?
I don't know. And I don't know. I'm not in that practice anymore. But
Oh, there, I see.
I couldn't prescribe ivermectin. I mean, I was so desperate to help people, and all I could do was pull up the FLCC website and go by their guidelines of nutraceuticals. I couldn't use ivermectin. I was threatened that I would lose my job if I ever even mentioned it again.
We are so lucky that India came to the Leading Edge Clinic.
We are.
Oh, you're so sweet. Well, I'm lucky to have you, Karen, with your compassion.
We're all lucky. Absolutely.
Yeah.
Well, what a great presentation. Yeah, I like the way you did that. I think, it was very informal, but not sterile. I think the conversation was intriguing, and I think you really did shed light on how complicated this is, and I appreciate you taking the time to do this. And you too, Karen, I appreciate you coming on. And thank you, audience, for tuning in. Do look forward to our next show. I believe our next one will be, and we'll look for our newsletter, look for posts on X and Facebook, but Nick, our CFO, and I are going to have a discussion with Twyla Braze. So Twyla Braze is the CEO of Citizens Council for Health Freedom. She has been in the trenches for 2 decades fighting for health freedom. She's an OG. She has been blowing the whistle on what HIPAA really is. And now we are going to have a discussion about this new bill that was passed, this digital health ecosystem that Donald Trump has passed, which is not a good thing. And we are going to dig deep into the weeds into that and let you know how you can kind of defend against the negative aspects of that. So continue to watch our show. We really appreciate you tuning in. Everyone, have a great night. Thanks again.
Thank you, Mark.
Thank you, Mark.